Welcome to In Alignment, Life, Leadership, and Dentistry. I'm Dr. Sara Mahmood, dentist, aligner educator, speaker, and mom of three, navigating the wild ride of clinical practice and family life. This podcast is your go-to space for all things clear aligners with real talk on dentistry, leadership, and the juggling act we call life. Whether you're looking to level up your aligner skills, build more confidence in your workflow, or just feel a little more seen in this season, you're in the right place. Let's get in alignment and grow together. Hey everyone, welcome back. Now, one of the biggest advantages of using SureSmile is that we can address a variety of bite issues, everything from crowding and spacing to deep bites and cross bites, but recognizing these issues quickly and more importantly, explaining them in a way that patients understand is the key to case acceptance. So this is exactly why I leverage the quick assessment tool for common bite problems. I love using this in my practice. This guide is laminated and placed in every single treatment room, and it helps facilitate chairside education in a way that's consistent, fast, and super patient-friendly. So let's talk about why it works so well. First, it standardizes communication across the team. My hygienist assistants and doctors are all using the same terms and the same visuals, and that consistency really builds trust. Second, it saves time. No more long-winded explanations, just a simple visual match and a short, relatable explanation. And third, it boosts case conversion. When patients understand what's going on in their mouth, and the why behind the recommendation, they're way more likely to say yes. And so here's how we use it during hygiene visits. Let's say Susie is in for her cleaning. My hygienist scans her early in the appointment, pulls up the simulator, and notices some crowding. She then references the quick assessment tool and says, Susie, I noticed your bite falls into one of the most common categories we see here. Let me show you what that means. Susie may not have ever known that crowding was a misalignment or that meant that anything was wrong. But by pointing to the image of crowding in the laminated guide and continuing to say, because these teeth are so close together, they're harder to clean, which increases your risk for cavities and gum disease. Or if it's an overbite, you can say, Susie, your top teeth are overlapping quite a bit. That puts a lot of stress on your jaw and can wear down enamel over time. Then when the doctor walks in, the hygienist says, Dr. Sara, I scanned Susie today. We noticed some lower crowding and I showed her the simulator and quick assessment tool. She seemed interested in learning more about aligners. That smooth handoff is everything. Again, a lot of our patients are coming in not realizing that their teeth are in a state of occlusal disease. And so by using this guide, it supplements the scan because now that they can see that their teeth in this malocclusion guide matches what looks like their teeth in the scan. And so later on, if a patient comes in for a dedicated aligner consult, you can still use that tool to build urgency and tie the concern for the known malocclusion. You can start by asking, what made you interested in aligners? Or the way we like to frame it is, what would you like to improve about your smile or your bite? Once they answer, you can use the tool to connect their complaint to a real diagnosis, something visual. Oh, well, this type of bite can lead to gum recession or jaw discomfort, which is why treating it now can prevent bigger issues later. And then give them the good news. SureSmile can help you align your teeth and improve both function and aesthetics. So let's take a scan and show you what your potential results could look like. How do you make this a part of your system? First, you can actually ask your rep. They'll probably be more than happy to print and laminate it for you and get copies in every treatment room. Or you can print it yourself. Next, you can train your team, make sure they know how to use it, where to find it, and what language to use when explaining it. You can also build it into your consult scripts, use it consistently in hygiene and in your aligner consultations. And finally, just use it as a visual aid when the simulator doesn't quite land. I've had cases where the before and after scan didn't look dramatic, but this tool helped reinforce the need for treatment. Remember, the more educated a patient is about their bite, the more likely they are to move forward. So simplify your language, empower your team, and use the visual consistently. It's one of the easiest ways to boost case acceptance and help your patients truly understand their oral health. Thanks for listening, and I'll see you in the next episode.